Well, to understand how glaucoma affects the eye, it is important to understand how the eye sees or works. Light rays enter the eye through the clear cornea, then through the pupil and the lens. These light rays are focused onto the retina, a light-sensitive tissue lining in the back of the eye. The optic nerve is connected to the retina and is made up of many nerve fibers. Signals from the retina are sent through the optic nerve to the brain, where they are interpreted as the images we see. In a healthy eye, a clear liquid called aqueous humor circulates inside the front portion of the eye. To maintain a constant eye pressure, which is 12 to 21 millimeters of mercury, the eye continually produces a small amount of aqueous humor, and an equal amount of this fluid flows out of the eye through a microscopic drain called the trabecular meshwork in the drainage angle. Now, glaucoma is a chronic or acute condition that affects the eye, in which there is increased intraocular pressure characterized by peripheral vision loss and damage to the optic nerve. Glaucoma is a disease that damages the optic nerve. This nerve is responsible for sending visual messages from the eye to the brain. Glaucoma typically happens when the fluid in the eye does not drain as it should. Fluid gradually builds up and increases pressure in the eye. That pressure is what damages the optic nerve. Blindness from glaucoma can often be prevented with early treatments. Treating glaucoma won't bring back any vision you've lost, but it can help save the sight you still have. Heredity, diabetes, migraine, myopia, eye injuries, and steroids can cause glaucoma. In the healthy eye, fluid called aqueous humor is made in the front of the eye and flows out through a tiny drain called the trabecular meshwork. The trabecular meshwork is located in an area called the drainage angle. If fluid doesn't flow out of the drainage angle properly, eye pressure increases and damages the optic nerve. You can classify glaucoma as open-angle glaucoma and closed-angle glaucoma. Open-angle glaucoma, also called chronic glaucoma. In this condition, the trabecular meshwork is partially closed. This results in gradual increase in intraocular pressure, almost always in both eyes, causing optic nerve damage and a progressive loss of vision. In closed-angle glaucoma or acute-angle glaucoma, the trabecular meshwork is completely blocked, resulting in sudden attacks of intraocular pressure, usually in one eye. Therefore, closed-angle glaucoma is considered as a medical emergency. During trabeculectomy surgery, your ophthalmologist makes up a tiny incision in the conjunctiva, the clear lining of the sclera or the whites of the eye. This is done under your upper eyelid and near the edge of the iris. Next, he or she will create a small flap in the sclera underneath the incision. Then, a tiny piece of tissue is removed under the flap to make an opening into the eye. A small piece of the iris may also be removed to keep it from blocking the opening. This opening serves as a new channel for fluid to drain gradually from the eye, reducing pressure. The flap is sewn back into place with tiny stitches which help guard against too much fluid draining out of that point. With laser iridotomy, the ophthalmologist uses a focused beam of light to create a tiny opening about the size of a pinhead in the iris. This opening allows trapped fluid behind the iris to flow into front of the eye, usually reducing pressure. A laser iridotomy is an important procedure to treat glaucoma that can damage the eye and your sight.